Hi everyone, welcome to Pharmacology. So today we will discuss some more case-oriented or patient case-based questions. So starting with today's first question, a new 60-year-old patient presents to the medical clinic with hypertension and angina. He is 1.8 meters tall with a waist measurement of 1.1 meter. Weight is 97 kg. Blood pressure is 150/95 mmHg and pulse is 85. In considering adverse effects of possible drugs for these conditions, you note that an adverse effect that nitroglycerin and prazosin have in common is. The options are bradycardia, impaired sexual function, lupus erythematosus syndrome, orthostatic hypotension, weight gain. Okay, so here the particular patient has got two conditions. One is hypertension and the next one is angina. And the medications given in the question is nitroglycerin and prazosin. Nitroglycerin is an anti-anginal drug, whereas this prazosin has been given for this hypertension, which is an alpha blocker. So in this question, we need to find out the adverse effect that is common for both nitroglycerin and prazosin. So here the correct answer is option D, that is orthostatic hypotension. This orthostatic hypotension, also known as postural hypotension, it is a medical condition wherein a person's blood pressure drops when they are standing up or sitting down. So both drugs cause venodilation and reduce venous return sufficiently to cause some degree of postural hypotension. Bradycardia, which means decreased heart rate, lupus, weight gain, and urinary retention occur with neither of these drugs. But prazosin has been used to relieve urinary retention in men with prostatic hyperplasia. Next one. A man is admitted to the emergency department with a brownish cyanotic appearance, marked shortness of breath and hypotension. Which of the following is most likely to cause methemoglobinemia? The options are amyl nitrite, isosorbide dinitrate, isosorbide mononitrate, nitroglycerin, sodium cyanide. So first of all, what is methemoglobinemia? It is a condition in which a higher than normal amount of methemoglobin is found in the blood. Methemoglobin is a form of hemoglobin that cannot carry oxygen. So in this condition, that is in case of methemoglobinemia, tissues cannot get enough oxygen. So symptoms may include headache, dizziness, fatigue, shortness of breath, nausea, vomiting, rapid heartbeat, loss of muscle coordination and blue colored skin. Methemoglobinemia can be caused by injury or being exposed to certain drugs, chemicals or foods. It can also be an inherited condition. So in this question, the drug which is most likely to cause methemoglobinemia is option A, that is amyl nitrate. So read the question carefully as well as the options. Nitrites are responsible for causing methemoglobinemia in adults, not nitrates. Okay, and this methemoglobinemia is deliberately induced in one of the treatments of cyanide poisoning. So hence came the answer as option A, that is amyl nitrite. Next question. A 45-year-old woman with hyperlipidemia and frequent migraine headaches develops angina of effort. Which of the following is relatively contraindicated because of her migraines? The options are amlodipine, diltiazem, metoprolol, nitroglycerin, verapamil. So here we need to find out the drug that is contraindicated in migraines. Okay, drug that can be used for angina, but here the patient has got hyperlipidemia, migraine as well as angina. So we need to choose the suitable drug, or we need to find out the drug that cannot be used in this particular patient, okay, because of migraine. So among these options, amlodipine is a calcium channel blocker, diltiazem and verapamil are non-dihydropyridine calcium channel blockers, metoprolol is a beta blocker, and nitroglycerin is an anti-anginal drug. So here the drug that is contraindicated is option D, that is nitroglycerin. Why? Because acute migraine headache is associated with vasodilation of meningeal arteries. Of the drugs listed, only nitroglycerin is commonly associated with headache. One of the most common adverse effects associated with the nitroglycerin is headache. Okay, so because of this reason, nitroglycerin is contraindicated in migraines. So in fact, calcium channel blockers and beta blockers have been used with some success as prophylaxis for migraine. Moving on to the next question. A 65-year-old woman has been admitted to the coronary care unit with a left ventricular myocardial infarction. She develops acute severe heart failure with marked pulmonary edema but no evidence of peripheral edema. Which one of the following drugs would be most useful? The options are digoxin, furosemide, minoxidil, propranolol, spironolactone. Here, the correct answer is option B, that is furosemide, which is a loop diuretic. Acute severe congestive heart failure with pulmonary edema often requires a vasodilator that reduces intravascular pressure in the lungs. Furosemide, as I have already mentioned, it is a loop diuretic which has got vasodilating properties or vasodilating actions in the context of acute failure. Pulmonary edema also involves a shift of fluid from the intravascular compartment to the lungs. Now let's see why the remaining options are wrong. Minoxidil, it would decrease the arterial pressure and increase the heart rate excessively. So it cannot be used as a good option in this particular patient. Then digoxin, it is an inotropic agent as well as a cardiac glycoside. It has got slow onset of action and it lacks vasodilating effects. Then spironolactone, it is a potassium sparing diuretic. It is useful in case of chronic failure but not in acute pulmonary edema. So, in this particular condition, that is pulmonary vasodilation and removal of edema fluid by diuresis are accomplished by furosemide, which is a loop diuretic. Okay, so hence the drug which would be most useful in this particular patient is furosemide. Question number 65. A 72-year-old woman has long-standing heart failure. Which one of the following drugs has been shown to reduce mortality in chronic heart failure? The options are atenolol, digoxin, dobutamine, furosemide, spironolactone. So here the correct answer is option A, that is spironolactone. It is a potassium sparing diuretic. So of the drugs listed, only spironolactone has been shown to reduce mortality in this highly lethal disease. Digoxin, it is an inotropic agent as well as cardiac glycoside. Then dobutamine and furosemide are used in the management of symptoms. Okay, so the remaining options cannot be used or they have not been shown to reduce the mortality in chronic heart failure. Only spironolactone has been shown to reduce mortality in this long-standing heart failure or chronic heart failure. So with this question, we have completed today's question discussion series. Thank you everyone for watching this video. If you have any doubts, you can post it in the comment section. So please like, share and support me. Have a great day.